tears on the surface of the eye are made of two components, a watery layer and a thin oil layer that floats on the water to trap it and stop the water from evaporating. The treatment for dry eye is usually artificial teardrops to lubricate the surface of the eye, but if you also have a poor oily layer, it is usually associated with the condition of blepharitis of the lid margins, and it is important that this is also treated as well. There are many different types of artificial teardrop that are available for use, but it is important to try, if possible, to obtain a drop that is preservative free, as this is kinder to the eye than drops that contain preservative, and they are now readily available. The frequency of instilling the drops is very much up to you and the severity of your symptoms. Drops can be put in the eye every hour in severe cases, and the best way is to put them in frequently in the first instance until the symptoms improve, and then slowly reduce the number of drops a day until you find a frequency that keeps the eyes comfortable. If you obtain an artificial teardrop that does not seem to suit you, try a different drop, as there are many on the market and some suit some eyes better than others, and there is a degree of experimentation required. But still, if possible, try to stay with the preservative-free type of artificial teardrops. If just the artificial teardrops alone do not produce a significant improvement in vision, one option would be to block the beginning of the tear ducts that drain tears from the surface of the eye to the nose. There is a small opening on the inner side of the upper and lower lids that collects the tears, which then flows through the tear duct and into the nose. Because of gravity, most tears flow through the lower lid, and a small plastic solid tube can block the opening of the tear passage on the lower lid to stop the tears from flowing away, and so keep them on the surface of the eye for a longer period. This is something that is easily performed with some local anaesthetic drops and only takes a few minutes in an outpatient setting. Sometimes the dry eye is worse at night, and the eyes dry out at night when you are no longer blinking and can be very difficult to open, in particular first thing in the morning. If you get these symptoms of worse symptoms in the morning, then you can get some lubricating ointment to put in the eyes before you go to bed at night to help keep the eyes moist at night. The ointment, however, will blur vision. Drops do not blur vision, so do not put the ointment in and then try reading before you go to sleep. It's the last thing you put in before you go to sleep. If there is severe dry eye with evidence of inflammation, then steroid eye drops may be needed for a short period of time to control the inflammation and improve the symptoms. There are some new drops that also control inflammation in a slightly different way, which are not steroid drops, but both the steroid drops and these other drops do require supervision by an eye consultant if the symptoms are sufficiently severe to require these drops. Most people, however, can improve symptoms by using frequent, preservative-free artificial teardrops from the chemist, together with regular lid hygiene, as usually dry eye is associated with blepharitis of the lid margins, and this combination of artificial tears and lid hygiene is the most important way of treating dry eye.